hemorrhoids can actually be prevented during pregnancy. Who would have thought? You don't actually have to have hemorrhoids. I'm going to teach you every way to humanly prevent getting those irritating hemorrhoids during pregnancy. Everything I'm about to tell you is actually not just beneficial for preventing hemorrhoids, but can help you manage vulvar varicosities and also help you prevent getting anal fissures. So let's break it down. So in order to help prevent hemorrhoids, you have to learn how to manage your intra-abdominal pressure. What the heck is that? That just means that the more pressure you have in your belly, the more pressure is going to be down on the vasculature, which can create a hemorrhoid. And what that looks like is a ball of skin tissue that's inflated with blood. So that would be an external hemorrhoid, and they tend to be irritating, itchy, painful, and not comfortable one bit. Sometimes they actually get worse during childbirth when you're like pushing the baby out. So intra-abdominal pressure is like this. When you take a nice deep breath into your belly, you inhale, and then you go do something like move up and down. That is increasing your intra-abdominal pressure. You've inhaled all the air, increasing the pressure in your abdomen, and that puts a force down on the pelvic floor, down on the pelvic organs, and down on the vasculature. Can put more pressure on the vasculature, popping out hemorrhoids. So how to prevent that? By managing your intra-abdominal pressure. When you exhale, all the air, you actually decrease your intra-abdominal pressure. So if you do all your movement with exhaling, so you've already inhaled, of course you have to inhale and exhale. You already inhaled, and now you go to exhale, you get all that air out of your body, and then you do the movement like going from sitting to standing or lifting something heavy. That is going to help you decrease your intra-abdominal pressure when you do anything with exertion. Same goes for getting out of bed. When you get out of bed, of course, you want to roll to your side. That will help, again, decrease intra-abdominal pressure. You exhale, blow the air out, and then you sit up after you roll to your side. That is managing intra-abdominal pressure. So when you have hemorrhoids, or you want to prevent getting hemorrhoids, you have to learn how to manage your intra-abdominal pressure. There is a second caveat. If your pelvic floor is really tight, that is going to increase the intra-abdominal pressure. If I had a balloon here and I squeeze the bottom of the pelvic floor, that will put more pressure on the top part of the balloon, increasing intra-abdominal pressure. When you have a tightened pelvic floor, that can put pressure on the vasculature, the veins, which can then pop out a hemorrhoid. So learning also how to manage your pelvic floor tension, your pelvic floor tightness is going to further help you prevent hemorrhoids. So one way to do this is by taking some nice, deep diaphragmatic breaths. When you breathe into your belly, all the air, yes, intra-abdominal pressure is increasing, but actually what you're also doing is you're hopefully opening your pelvic floor. So when you take a belly breath and inhale, you want to also imagine like you're opening your anus or you're opening your vagina, and that is going to help reduce the tension inside the pelvic floor, further decreasing your intra-abdominal pressure like we talked about earlier. So again, that's going to help prevent the hemorrhoids. Now, some people also have, so we talked about external hemorrhoids, some people have internal hemorrhoids. Internal hemorrhoids are hemorrhoids that are above what's called the pectinate line. If this is your rectum and this is a line, if it's above the pectinate line, you actually don't feel internal hemorrhoids. They're not painful, they're not itchy, but what they can cause is they can cause bleeding. And if you're like, I don't know why I'm bleeding, but I am, then you probably have internal hemorrhoids. Again, we want to prevent all of that during the pregnancy itself, and also so when we get to delivery, we're not susceptible to making any hemorrhoids worse or bursting any hemorrhoids. There's other conditions that I spoke of earlier, the vulvar varicosities, that we also want to help manage and prevent. Vulvar varicosities are when the labia, the vasculature, the veins in the labia become distended. And this ends up with, you feel like your labia are very large, you feel like there's a lot of heaviness in the labia, and it can be really, really achy and uncomfortable, especially gets worse by the end of the day because of gravity. And so managing intra-abdominal pressure becomes really important to help take the pressure off of those vulvar varicosities. There's also support garments that can help prevent that discomfort and heaviness and achiness of the vulvar varicosities. I like to recommend, though, because not all the support is lovely. I actually have patients that have a really good response to wearing a thick menstrual pad in their underwear, and that just gives enough tactile sensation that is supportive of the labia themselves, and that can help reduce the discomfort from the vulvar varicosities. Next up, we have anal fissures. Anal fissures are little cuts through the anus that can happen when you have hard bowel movements or when you have a really tightened pelvic floor and the poop, you have to work really hard to get the poop out. So again, managing intra-abdominal pressure and opening of the pelvic floor can help decrease the risk of getting anal fissures. There's a couple other things that you should talk to your healthcare provider about. Maybe adding in a magnesium or a raha psyllium or an aloe vera juice to help lubricate the stool, bring more water into the stool, helping make sure that you can pass these bowel movements that are smooth and soft, well-formed, and easy to get out of your body, which will help decrease the risk of getting any tears around that anus. So I hope you found this video helpful. Again, we want to prevent hemorrhoids, we want to prevent vulvar varicosities and or just help support them. Same thing with anal fissures. I'm Dr. Allison Feldt, owner of Body Motion Physical Therapy and your host of the Aligned and Elevated podcast. I hope you found this helpful. Drop in the comments below if you are having issues with hemorrhoids, vulvar varicosities, or anal fissures, and I would be happy to give you some advice that is personalized to you. Please like and subscribe and share this to all your friends who are pregnant. Take care.